There's a lot more to be said about trauma-informed care and whole certification programs that are available for practitioners. But in my practice, Hope and Freedom, we have very intentional tools that we provide to all our certified Hope and Freedom practitioners that are providing targeted support for the niched clientele that we serve. You may want to invest more time and effort into developing this particular area of expertise for your practice, or seek certifications like we offer through Hope and Freedom Institute. But in the meantime, here are some other helpful tips that will help you establish a trauma-sensitive environment for your clients. First, establishing a safe and supportive environment is paramount in trauma-sensitive therapy. Ensure that the therapy space feels comfortable and secure, that you communicate clearly about confidentiality and boundaries. Respect the client's autonomy and empower them to make decisions about their therapy. Offer choices whenever possible and involve them in treatment planning and goal setting. Be mindful of cultural differences and how they may impact the therapeutic process. Respect and honor the client's cultural background, their beliefs, their values, and consider how these factors may influence their experiences of trauma and healing. Validate the client's emotional reactions and normalize common responses to trauma, such as hypervigilance, dissociation, or emotional numbing. Help them understand that these responses are adaptive survival mechanisms. Also, be mindful of the language that you use and its potential impact on trauma survivors. Avoid using language that blames or shames the client, and instead use validating and empowering language that fosters a sense of safety and trust. Teach your clients grounding techniques to help them stay present and regulated during the sessions. This may include deep breathing exercises, mindfulness practices, or sensory grounding techniques. Emphasize the importance of self-care and help your client develop self-soothing strategies to manage distress outside of the therapy sessions. Encourage healthy coping mechanisms such as exercise, creative expression, and spending time in nature. Be vigilant for potential triggers and help clients identify and manage them effectively. Create a plan for coping with triggers as they arise during the therapy sessions. Ensure that the client feels safe and supported throughout the process. Offer psychoeducation about trauma and its effects on the body and mind. Help clients understand the neurobiology of trauma and how it can impact their thoughts, emotions, and behaviors.